Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Venditti, our hospital system general director, giving you the update from Albany Medical Center on the coronavirus. Today is Incident Command Day 38. We can report in the 5 surrounding counties the number of positive cases for COVID-19 is 1,227. Yesterday it was 1,100, so that's a pickup of about 100 cases since yesterday. Fred, I think we have some numbers from the region and also from New York City.
Yes, so the regional numbers have gone up, Dennis, but every day we talk to the other hospitals, and so we know what the hospitalization rates are. And so while the total numbers have gone up, the hospitalization numbers have gone down. And so I think the numbers have gone up because of increased community testing. Down in New York, actually, things have flattened and actually declined a little bit. The number of hospitalized patients has gone down about 3%.
And to that point, here in the medical center, the number of positive COVID-19 patients we're treating in the hospital is the same number as yesterday. That's 61. The breakdown is 26 on the floor, 35 in the ICU, and actually we have 2 more patients who came off ventilators compared to yesterday, so that is also some encouraging news. So to your point, the community numbers go up, but we're not seeing an increase in hospitalizations.
That's right.
Okay, very good. Yesterday we spoke about the executive order related to masks, and we knew that we would pick it up again today, so let's do that. This is an executive order signed by Governor Cuomo on Monday. The requirement is for all essential businesses, which we are one, must provide to their employees face covering. So we want to dive into that a little bit more. This executive order covers all essential businesses, not just healthcare organizations. Therefore, this weekend you'll find that when you go into the bank, for example, bank tellers will be wearing masks. If you go into a home improvement store, the people that you're checking out from will be wearing masks. Inside here at the medical center, what this means is that there are members of our healthcare delivery team who a week ago would be providing care and they would not be expected or required to wear a mask, but under this new executive order, they will. And this goes into effect 8 o'clock tonight. And as we mentioned yesterday, we're absolutely prepared to do that. And we got a shipment of masks in, but we want to talk a little bit more about that.
So let me make a few points about how this policy is going to work. So first of all of our staff that have direct contact with patients or the public, and I would emphasize direct contact, are going to be required to wear a mask, and we'll be providing those masks. And they'll be the standard procedural masks that have loops that go around your ears. We're going to hand those masks out at the time that people get their temperatures taken. So we've been taking the temperature of all our staff. So if you get your temperature taken at the front door, you'll get a mask there. If you get it taken at your nurse's station, you'll get a mask there. We're also going to instruct staff to dispose of the mask if it gets visibly soiled or moist or otherwise contaminated and take a new mask. But we really want the staff to wear the mask for as long as possible without touching it. The mask is there to protect you, so if you have contact with a COVID positive patient, the droplets adhere to the front of the mask, and so you don't inhale them. But if you touch the mask, now you have those droplets on your hand. And if you touch your eye or something else, you can contaminate yourself or something else. The last point I would make about this is wash your hands. Wash your hands, wash your hands. Before you pick up the mask to put it on, wash your hands. When you take the mask off, wash your hands. You can't wash your hands too much. When you come in tomorrow and get your mask, you're also going to be handed a flyer, and that's right here. It's 2-sided. It talks about the points I just made, and also talks about the way to wear the mask and things not to do with the mask.
Fred, let's dive into that a little bit more. First of all, when people are wearing masks on floors that have COVID-19 patients, we often have face shields for them as well, correct?
Yes. That's right. So if you're working on one of our COVID units, in addition to a mask, you're going to have a face shield that protects your eyes and also protects the mask. So the mask can be used for a longer period of time.
Second question out of 3, cloth masks. I know that people think that a cloth mask is a face covering. There's actually rules that the Department of Health have published about what is a mask, what is a face covering in a hospital setting.
Right. A cloth mask is not a PPE in a hospital setting, in a healthcare setting. So you can see people wearing masks out at Price Chopper or in home improvement stores, etc., but not in the hospital. That's not an appropriate face covering.
And you mentioned yesterday that we received a good shipment in of masks.
We did, yes.
But maybe just to sort of talk a little bit more about that, how many masks a day or a week does the medical center go through?
So this is a big place. We employ a lot of people. And so we can use anywhere from 60 to 140,000 masks in a week. And that depends on the burn rate, something we're tracking, how often people take a mask off, put a new one on. But we use a lot of masks. So yesterday we did receive over 150,000 masks, and we have more in the pipeline. But we need to be very cautious about how we use masks so that we're sure that we have enough as we go forward.
And when we talk about using as many as 140,000 masks per week, that's the reason why the N95s are only used in certain circumstances and the surgical masks are used in other circumstances.
Our epidemiology group has developed a plan that's really around safety and conservation. So the PAPRs, you'll see some people in PAPRs, which can be reused. That's to conserve. The N95s are for the really high-risk procedures, the aerosolizing procedures. We need to conserve them for those kinds of situations. And then the procedure masks are for all the other situations that our employees are in.
Okay. Well, we'll obviously continue to talk about masks. In fact, there'll be more to talk about as the week goes on. Let's end on two really good stories. The first one is convalescent plasma. We continue to receive hundreds of phone calls from people in the community who are interested in knowing if they are potentially a donor for plasma. When we first spoke about this, we said we have 5 matches, meaning 5 donors that would be able to give their plasma that we could then give to a patient here at the medical center. That number is now up to 8, and we believe it will be 12 within a day or two. So once that plasma comes back from the Red Cross, we know that we're going to be able to give that, and that's a remarkable bit of information.
It really is. It really is.
So 262-9340 is the number that you would call. The last thing we want to talk about is a subset of patients here at the medical center that we're caring for that is unique to Albany Medical Center today. And that is 2 patients who are currently getting ECMO. That's spelled ECMO, which is extracorporeal membrane oxygenation. And Dr. Venditti will describe this to us. Fred will describe this to us. But these are patients who need prolonged support for both cardiac, meaning their heart, and respiratory, meaning their lung support. And this is a really special thing that we're doing here at the medical center.
It really is, Dennis, and it's for patients who are really ill. There's a very, very specific set of criteria that we use for those patients to put them on ECMO. So think about the heart-lung machine. I think everybody kind of understands what that is. If you have open heart surgery, your blood is routed through a machine that functions like your lungs and your heart. Well, ECMO is a bedside way, essentially, of doing that same thing. So in this particular circumstance, it functions like your lungs. So your blood goes through that oxygenator, and it kind of rests your lungs and gives you a little bit of time for the lung damage to heal. And so, as you said, there are 2 patients right now. I believe we're actually evaluating a third that will go on this. The 2 patients, as I mentioned yesterday, are young. They're under the age of 40, and one of them seems to be doing a little bit better. So we have our fingers crossed.
And that one who seems to be doing better is the first patient who got the convalescent plasma.
Right.
This is a certain group of patients that are selected by a multidisciplinary team. The care is delivered in our CPS unit, our cardiopulmonary unit. Our facilities team created a negative pressure suite. So we thank the incredible care delivery there, and we thank the facilities folks for creating that, and we hope to give you some updates as we go. Let's end on our shirts. I'm wearing radiology. Radiology is obviously an important part of our care delivery team. They often go to the bedside to take x-rays, or the patients are brought to them. But they're incredibly dedicated, and they do all sorts of disciplines, x-ray, CT scan, MRI, ultrasound. Shout out to radiology.
And I have a logistics shirt on. So this is one of the sections of our incident command. And these guys and gals are out there scouring literally the world to try to find masks, gowns, etc. for us. They're also coordinating all of the internal activities that are allowing us to care for these patients. Think negative pressure rooms, getting enough equipment into those rooms, etc. They're doing a fantastic job. Shout out to them.
Okay. So that ends today. Obviously, a lot of great things happening here at the medical center thanks to our incredible workforce. We thank all of them. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.